Just talk about Medicare in general from that. One of the things that we've recently acquired a company that allows us to be able to do medication adherence called the PillDrill. And we're able to, especially with individuals that have pain management issues, to start using the medication adherence part of it and to be able to bill Medicare, or Medicare takes care of it, under remote therapeutic monitoring, or RTM, from that. So we're offering, to our Medicare side of individuals, both the pill drill through remote therapeutic monitoring, but we've recently started offering remote patient monitoring through them as well. And that's where we will send out a scale of blood pressure, typically cellular operated, cellular embedded, so they don't have to have a phone. Remember we talked about, my mom and dad. I'm a big believer that one solution doesn't fit all, right? Since they're from Iowa, I'll use the field of dreams. Like if you build it, they may not come, right? With healthcare as well. So you have to build things that are very adoptable and adaptable by people as well. So in the Medicare program, we can send out a scale of blood pressure that's self-configured, comes in the home, allows them to be able to take their readings. And then recently, we have partnered with several care management companies or monitoring companies. One of them is CareTalk Health. CareTalk Health has over 1,500 providers and nurses that allow us to have that data from our devices come into CareTalk, right? And they monitor the patient on a regular basis to make sure they're okay, and then it is billable to Medicare to be able to do that. So we find a lot of people, like when I had my mom and dad living in Iowa, that could be able to use this service and be billable under their Medicare program, so they could live remotely and stay connected to an actual nurse practitioner, or to an MA, or to a provider, to be able to monitor them on a regular basis. And under the RPM programs, Medicare stipulates right now that there have to be 16 days for the readings to come in. So we have to keep the patients engaged along the way to take their readings. But as of January, we're still going to have to keep them engaged, but it's only requiring 2 days of readings to come in, which is very beneficial to connecting people at home, because more and more people will be able to qualify and take readings and have their readings reimbursed on a regular basis through that new program.